But Dave Chase with Health Rosetta is going to be joining us today. Dave always does a phenomenal job with these, brings wealth of information. Relocalizing healthcare, communities are taking back healthcare and rebuilding the American dream. So it's been an ongoing focus for Dave and Health Rosetta. Excited to dive into the most recent reiteration of this and what they're doing to change the landscape across the country. We've been proud sponsors of Health Rosetta from the very beginning, and they just keep giving back to the entire industry. So look forward to diving in here, Dave, and welcome to the June show.
Yeah, great to be back. It seems like a kind of a summer ritual for us, and fortunately, lots going on, and finally some good forward momentum. So, looking forward
Good.
to chat.
Good, good. And of course, I forgot my housekeeping items before we really get diving into this, but we always welcome guest participation. So if you have questions or comments, I like the questions usually more than the comments, but put them into that Q&A section. There's also a chat function that sometimes people put their question in. That does make it a little more difficult for me to manage the questions. So I'll read the questions out as we go, but if you can put them into that the Q&A portion of the tool here. So with that, actually, I don't even see the Q&A thing on here. Did they change Zoom on me while I wasn't looking? I'm gonna investigate once Dave gets going. But I see the chat function. I don't see the Q, but we will see. We will see. All right, guys. With that, Dave, let's turn it over to you.
Yeah, well, the probably biggest update that you all will get an early look at is I've got a new book coming out. Um, Heath alluded to it. The full title is Relocalizing Health, Taking Back Healthcare, Rebuilding Communities. And if you're really on top of it, I did do kind of an earlier version of that came out right at the start of COVID. And between obviously a few other things going on, but mostly there's been so much that's happened in the last 6 years. It's pretty much a complete rewrite. And fortunately, there's a lot of great developments, and there's been legislative, regulatory wind in our sails. There is the full sort of generational shift, I think, is kind of an underestimated facet that, we have legacy health plans that were designed in the era when the greatest generation and boomers were the workforce, and it was acute conditions that were the main concern. You have now 70+% of the workforce are millennials and Gen Z, and the oldest millennials aren't that young anymore. They're mid 40s. And really the between generational expectation shifts, but really probably more than anything, chronic disease and mental health are two of the bigger issues that really the old plans, tried to bolt on some fixes. So there's a big shift there. There's a maturing of the category we're all in. If you add up the revenues of the new primary care models, the sort of work 6 Degrees is doing in terms of different types of, um, contracting and procurement of medical services, it's already $100 billion industry. Like this is bigger than the US video game industry. So yeah, we have a long ways to go for it to be 5.6 trillion or whatever it is now, but it's a real legit industry. And on top of that, if you've been paying attention at all, um, we have a lot of changes in our economy. Of course, AI has come along, but there is just a wholesale change that AI is both this threat and opportunity, and we'll probably get into that. And really, a whole economic model shift is going on, and that's partly we've sort of seen the maximization of global supply chains. We saw that during COVID. Like we have this really brittle economy that's dependent on global supply chains, and across the economy, we're seeing more relocalization, and healthcare is a big, always people don't always think about healthcare, but like what's more local than a interaction between a individual and a doctor or nurse. And so lots of interesting things going on there. Um, I'm fully sober about the challenges we have, but I've never been more hopeful about what's happening and how people are really rebuilding it. And, this is my cue to like wave my iPhone, where we didn't get these guys by tweaking landlines and rotary phones, right? We saw a completely new industry supply chain, new standards. Like there's a lot of complexity behind the scenes. Um, and that's what we're having in healthcare, right? An entirely new supply chain has emerged, new market norms. The last one of these fireside chats, we talked about the standards that Nautilus Health Institute is putting forth. That's matured a lot. So plenty to talk about. That's probably enough of a preamble. But yeah, we're busy as an industry, and just as an example of what's happening, with Rosetta Fest right around the corner, we're going to have 200 or 300 employers there. That wasn't the case, a couple years ago, let alone before that. So lots of activity. Very excited to talk about it, and let's get into it.
Let's do it. So you argue that the healthcare story is not only about Washington, it's Main Street. Let's
Yeah.
let's talk about that.
Yeah. Well, there's Washington State, which I'm part of, which I know is what you weren't talking about. But just to clarify, yeah, the DC, the cavalry's not coming from DC to save us. I think that's pretty clear. It's not to say there aren't a few important things to happen there, but people are just done waiting, right? And you look at you know, Medicare, Medicaid passed in 1965, and there hasn't been all that much change since then. The ACA had some changes, but largely it was doubling down on the current system. And so what you're seeing is both private and public sector employers aided and in a great way by aligned benefit advisors saying we got to just rebuild this. And when I wrote my first book, and now it's been 10 years since my only TEDx talk. I joked I was an archaeologist. I had to dig so hard, like an archaeologist to find healthcare's Rosetta Stone. And I found about five, employers union combination, some cases that had cracked the code. But now we have thousands of successes in the Health Rosetta ecosystem, rural, urban, public, private, union, non-union, small, large, pretty much in every state in the union. And, we have a lot more to go. We need tens of thousands and hundreds of thousands, but it's no longer this fringe thing. It is becoming and moving towards kind of the new normal. And I think that's just testament to people who are like, okay, we have had dysfunction in DC for quite some time, and people are fed up, and it has life and death consequence, and certainly massive financial consequence too. So people are just stepping up and going, Main Street knows a few things. Let's get after it.
Yeah. Yeah, it's been amazing over the course of 6 degrees lifespan, anyways, which goes back to 2012. But to see the adoption with the larger plans, I mean, heck, I think at the upcoming Health Rosetta Fest, we've got a 7,000 life group that's up for Plan of the Year. I mean,
Yeah.
it's just gone quite a bit upstream, and we've got a 12,000 life group that we're working on, from an RFP standpoint right now. So to see the
Yeah.
the group the sizes and group sizes continually increase has been phenomenal.
Definitely. I mean, we're involved in a PBM RFP with I think it's about a 17,000 person utility. And there's been legal stuff that's happened, that I think has definitely woken up some of the employers like, oh crap, like we're gonna have a legal target on our back if we don't address this. And there's a business imperative, of course, too. And so And we've seen that in so many areas. In the old days, new tech would come and go into the, Department of Defense and Fortune 50 companies, and it would trickle down. It's pretty much flipped on its head. And whether it's iPhones or, social media, in a business context, it's the smaller, more nimble that sort of prove it. And then it's gotten laddered up from there. And like you said, there's lots of 1,000+ employers that are kind of joining the party that, I would say the sweet spot of what we've been doing is in that sort of 100 to 1,000 person company. They're certainly smaller, certainly have been larger, but now a lot more of those 1,000 to 10,000 and then, even higher. We're recognizing 32BJ, the SEIU union, boom, 200,000. Like you look at what they've done in terms of their contracting with hospitals, like really leading. And so there are some of those exceptions with the larger ones. Hopefully we'll get more of those. But in the meantime, the bulk of the workforce is in companies with under 10,000. So that's plenty opportunity for all of us.
Yeah, no, for sure. For sure. Um, the book that we're talking about today, and maybe take us on a quick tour of some of the things that are in there that would be of interest to the audience.
Yeah, yeah, definitely. I mean, it's book ended, the end of it is some pretty in-depth case studies. But I'll do my little cheat and look at highlight a few of the titles or
So
the
hold on,
chapter.
Dave. I'm going to come clean with everybody. This has been my most recent edition,
There you
also
go. There
on
you
my
go.
side. So yeah, I don't let everybody see them, but it's become pretty obvious at 51 years. I've finally given up on trying to see
Yeah,
without them. So
it happens. It definitely happens. So, yeah, I mean, in the preface, I talk about kind of my personal journey and why I became so passionate about this. And but then once you get into the book, really it's a setup of what it is that the way I describe the flow of money in healthcare sometimes is the every community has a river of healthcare money flowing through it. And the source of that river of healthcare money is all of our pocketbooks, right? There's not, I haven't heard of any Australians or Italians volunteering to pay for US healthcare. I sometimes joke like, we already have single payer. It's all of us. It's just a matter of how many fingers are in the pie. But that river of healthcare money should work like a water cycle, replenish, restore the communities like the actual water cycle. Instead, we have these giant pipelines that extract it out of our communities, leaving our communities in drought. And you see um, all these communities, the small ones that are, may have 50 staff, in some town of, 20,000 or something. And you literally I've seen stories like in the USA Today and local media that are, a small town that, can't basically their increased healthcare premium basically killed their parks budget, or they can't fill potholes, or they can't give teachers raises and all of that. And so I set it up as reclaiming the river of money and how that taking ownership of that makes a difference. And that's kind of the opening chapter. And then go down a little bit in terms of what what it means for local communities when these dollars get extracted and sometimes people haven't connected the dots and then get into this idea of economic development 3.0. It's using the healthcare card. Like the world-class healthcare plan broadly adopted in a given community is way better than any tax break to attract or retain a company. And, that's what I call economic development 3.0. Then talk a little bit about the generational shift I mentioned and and then about how the opioid crisis, right? People know about that. And I like to remind people like this is a unique American phenomena. We to this day even we're 4% of the world's population. We're prescribing 80 to 90% of the world's opioids. And even after all this awareness, and it is really a microcosm of the larger dysfunction, how we've destroyed primary care, how we've incentivized the wrong things and all of that. So I go into that a little bit and then probably the spine of the book is these two structural flaws that we have in our healthcare system. One is we separate the budgeting and governance of the sick care system, which consumes 90% of our health dollars, but only drives 10 to 20% of health outcomes from these other things like social services and public health and public safety and education and that. And so we screw that up, and then we get the scale of governance wrong. That's the other big structural flaw where we either are too small or too big. You know, we expect, the too small side, you know, a primary care doc is going to get less than an hour a year with a patient. Like, are they really going to solve all of society's problems, let alone their health problems in that time? Obviously not. But we put more and more and more on them. It's just crushing. And then at the other end of the spectrum, it's other than maybe one or two tiny states, a state and certainly the federal government's too big, right? It's too disconnected. And so we get the scale of governance. So I kind of get into that. And then following out of that, okay, if that's the case, how do we do it? How do you transform it? And how do we turn this health benefits into this thing that's been kind of a boat anchor on companies and the public sector and turn it into a true benefit? And then this concept of community-owned health plans, like that accelerates the growth of that. And then as kind of sort of getting into the tail end of the book, I go into Nautilus, how it is developing the market standards and norms for a completely new industry supply chain. And then um, I wrap up the book with two things. One is this choice that every community is making, whether it's conscious or not. Um, One of my favorite Rush lyrics is, if you choose not to decide, you've still made a choice. And that's basically the choices between the AI tax, right? This thing that's hitting our communities, having job costs, job losses, and we can just accept that, or we can use that as a catalyst to do some things we probably should have done before. And there's lots of roles that are immune to AI. And so that's this real choice. And then I conclude the book with this um, time travel metaphor where, say, okay, I just got back from 2036 and I paint this picture that almost sounds like utopia. Um, and the thing is, every one of those things that I talk about in this futuristic, utopian, sort of esque thing, it's all in place somewhere in the US. It's just not all in one place at scale. And so hopefully leave people with this hope that we can, there's this quote, the future is here, it's just unevenly distributed. If we get on it, like if a community really is on it, in 5 years, it could completely transform rather than waiting 60 plus years that we're now since Medicare passed. A community could do it in 5 years. If they're really on it, certainly 10 years. Now, every community is not going to start today, so we get it. It's going to take a while. So that's kind of the arc of the book. And, lots of case studies. We can talk some about those if you want. They're really incredible stories. So
I mean, what are some of you mentioned that some of these communities are doing at least bits and pieces of these
yeah,
things today. I recall there was some things in the appendix that kind of outlined some of these case studies. What are some of those so the
yeah,
audience
yeah.
gets a sense?
For sure. Um, there's ones we've been inspired by and had nothing to do. Rosen was one of those, although there's certainly a part of our community. Hopefully, people have heard the Rosen story. That was what I did a TED talk about, a decade ago, and it's only gotten better. One that we really inspired by, had nothing to do with, but I think it shows what's possible, is in Alaska, the Alaska Native community um, divides up the state into like I think six regions. One of them is called the South Central area, and there's this care model called the Nuka model. This is an organization that is the only organization in healthcare that's won, effectively what's the Nobel Prize of Business, the Malcolm Baldrige Award. And man, really tough problems. They serve 60, I think it's 70,000 people now, over the size of, you know, as big as Sweden. And man, check all the difficult boxes you can imagine in terms of disease burden and mental health and substance use, issues. And it was a complete disaster in the late, going into the late 90s when they took it over. Now many consider it the best system in the world, and people from all over the world come visit there. The CEO of that, April Kyle, she's going to come and we're going to honor her, but she's going to speak some at Rosetta Fest. She was on my podcast. But then in terms of uh, success stories that sort of natively grew out of our community. One of them is in Ohio, and this is a community of about 100,000 people. And so in that community, you had between 30 and 40,000 people in debt. You have 60% of kids on free or reduced lunch, medical desert, less than one third. The docks, no independent primary care, single hospital town. Frankly, a price gouging hospital that in some areas doesn't have high quality. Dot, dot, dot. Like, and a community just kind of layer in your stereotypes of a Midwest manufacturing town, opioid issues, all that. Boom, all those things. They have a great advisor leading their way called Bryce Heinbaugh. Bryce came to the very first Health Rosetta gathering that was in 2018. He was burnt out. He was successful financially, but hating life professionally, where every year he's got to deliver to his clients, you're going to pay more and get less. And he came to this event and he's like, wow, these are my people. I'm going to do it. Took a step in. And it started with a single employer with 38 employees, like not exactly Walmart. And it was a private sector employer. And then the big game change was when July 2020 was actually when this new health plan went in. But a little before that, this was a school district, only about 300 staff in crisis, eighth poorest school district in the state, dangerously low reserves. And so their hand was kind of forced, but they put this in, and it was outside the collective bargaining agreement time frame. So there was a lot of hands tied. Despite that, when there was a school levy that was up May of 2021, not even a year later, um, even though it was a really challenged community, they usually would pass their school levies. It failed. Normally disaster, right? Cut teachers, programs, benefits, transportation, extracurriculars. Fortunately, in that short amount of time, they'd save more money than the entire school levy. And now, if you fast forward to today, they have excess reserves. They're like, okay, what are we going to do? We've got millions and millions of dollars. I think $7 million, and I think it was maybe 200,000 when this thing got started. And they're like, what other benefits can we do? What can we do here? And so that's a type of thing. And now then, the city manager is married to a teacher, like, we want that. And then, of course, they collaborate with the county, like, we want that. And then the private sector guys are going, wait, I thought we were smarter and more nimble than the public sector guys. So the the dominoes start to fall. And one of the things as I've studied social movements and revolutions and new product category introductions for all these, massively hard challenges. There's a TED talk on this actually around the study that you only need about 3.5% of a population to tip a successful revolution. So I don't know if it's 3.5% or 5% here, but pretty quickly in a given community like Ashtabula, Ohio, you can get 3.5%, 5% of the employers, and all the fear, uncertainty, and doubt that the old guard uses to freeze status quo, it just stops working. People see it with their own eyes. They see it with their public, their tax dollars, and it just starts rippling around. And that's where you bring these big problems down to local scale, these problems that seem impossible to solve. They're in our seventh decade, since Medicare passed, they become solvable. And that's really the big story in that book is how do you go about doing that? How do you get that movement going? And yeah, of course, there's plenty of challenges along the way. We all know that. Um, and I'll hear, and I'll just wrap up this. I hear people go, man, this is tough. Like, yep. You know what else is tough? Being a great parent, being a great athlete, being a great musician, the most rewarding things in life are tough. Um, but that doesn't mean you don't do them. And that's the thing that's been a real privilege for me is to work with all these people who are like, okay, I'm going to get kicked in the teeth, on a daily basis, but I'm going to keep going because it's really important and it's really rewarding when you see the life-changing impact on people.
That's a great analogy on being a great parent, as I know my child is walking out of his classroom right now and he's going to go sit in a parking lot for the next 30 minutes.
Good, right? You
It's
learn a
going to be
little,
good. That phone's going to
yeah.
start ringing. We'll answer it live on the Fireside chat. We can all
Yep.
provide some guidance. Um, okay, so you mentioned earlier the AI tax versus the AI catalyst.
Yeah.
What impact should we be aware of as healthcare professionals?
Yeah.
What's coming, and what's your thoughts, anyways?
Yeah. I mean, here, McKinsey's done a report that says there's going to be 7 to 14% of the workforce impacted, da da da, right? Like, okay, who knows if they're exactly right? It's kind of abstract. Who knows when it's going to hit? There's a lot of hype. Some of it's real, some of it's hype. But let's talk about healthcare. Something that is super concerning that we started seeing several months ago was stop loss carriers exiting the market, right? They're used to shock claims, right? Um, but when their actuarial models just stop working, they exit the market. You've seen this with Swiss Re, Munich Re, Allstate. There's a number of them. I mean, there's been public market reports from some of the others that they're having 115% loss ratios. And so, we are all very dependent on there being a well-functioning stop loss market. And so that caused us to really dig in and and I had a strong instinct having started my career. It's a more innocent time, I would argue, in something called revenue cycle management inside of hospitals. I consulted inside hospitals. And then when I started Microsoft's healthcare business, our tech went in, frankly, to jack health hospital bills is largely what it did. And it's not like there haven't been games being played with our reimbursement system, and the employers really have taken the brunt of that. But that was almost child's play compared to what's going on now. If you look at, um, and this is all publicly available information, I was just basically able to piece together into a kind of holistic story and found that there's been $20 billion of venture capital just going into AI to fuel revenue cycle management. Some of the big companies you hear about, Palantir, some of the big revenue cycle, the McKinseys, the Deloittes, they're really actively putting in that. And so it's causing claims over $1 million, over $2 million to compound, at like 27, 29%. Blue Health Intelligence, which is the data analytics arm for the Blue Cross Blue Shield Association, they published a report looking at how AI adoption has driven billing inflation. And so there's, hundreds of millions. I think they estimated like 660 additional inpatient spending, a bunch in outpatient. And then just to give you one example of where this isn't just all of a sudden America's gotten a lot sicker and going to the hospital more. You look at data like postpartum hemorrhaging uh, has gone up threefold. Bills in that area have gone up threefold, even though transfusions haven't, right? Pretty hard to have a hemorrhage and there not be transfusions. So it's, you have AI doing all the things to manipulate the billing. And so, frankly, most employers are bringing a clipboard to a gunfight. And so this is something that people have to really be on top of it. Frankly, if you are not having access to your complete claims data and have the ability to do payment integrity, you are going to take it in the chin way worse than last year. It was bad last year, way worse. So that has caused us, and something that give you a little preview of Rosetta Fest. um, you could look at Health Rosetta, and then Nautilus is this independent nonprofit we help catalyze. You could categorize us as a industry association or a social movement, but essentially we've incubated a tech platform. That's actually the founder's backgrounds. Like I started, as I said, Microsoft's healthcare partner ecosystem many moons ago. So we've actually birthed a whole platform to make it easier to build these plans, but to manage them. And so we're doing a lot around data. We're doing a lot around compliance. We're doing a lot around payment integrity. And, obviously we're not the only ones doing some of those things. But that's going to be something that we're arming all essentially the way Health Rosetta is operated is there's about 400 employers that have been our performance lab that we're directly in the trenches with in tandem with our advisor, prove out these concepts over 2 or 3 years. Then we train all Health Rosetta advisors on it. These ideas get battle tested even more. And then the things that should become new market standards and norms and be much bigger than Health Rosetta is what goes into Nautilus. And so those are things that are, going to level a playing field because frankly, employers are up against a really tough opponent right now. And, it's like, your IT department doesn't have an anti-phishing, anti-hacking strategy, and unfortunately in that, analogy, our health systems have kind of become the hackers of employer and employee wallets. And so that's been a big, big deal. And we're really very focused in on that issue now. On the flip side, right, we can do something about it. And so that's where, uh, I read this book about a year ago called Goliath's Curse by Luke Kemp, and it studied 440 societal collapses. Guess what? For 99% of the population, it was actually better. And I think in many ways, we're having an economic structure collapse, and both at the healthcare level and more broadly. And we are, to bring in, I guess, another biblical metaphor, like we're building the ark, this ark or islands of resilience for communities so that they can weather this. And that's going to be a big part of my message in my keynote at Rosetta Fest is it's on all of us. Like this is going to hit our communities whether we like it or not. And we can either do something about it and have a community that's, it's like, hurricanes come. Some communities are um, defended. Babcock Ranch in Florida, go Google that. They've had these horrible hurricanes. It's all powered battery backup. They build this thing well. They're good when there's a hurricane. Other communities are devastated, and we're going to have that metaphorical hurricane hit our communities. And that's why, again, we think it's so important. It's a big effort to pull off Rosetta Fest. Like it's literally a seven-figure investment to pull that off. But that's where we come together and it accelerates this collaboration that we're excited about. So probably enough said on that, but it's really an imperative for all our communities.
Now I want to go look up Babcock Ranch. See what they got going on out there.
Yeah, it's really cool story. Um, Guess what? There's a little bit of sun in Florida, and they've taken advantage of that.
It's Hey, you mentioned Nautilus a couple times,
Yeah,
which got me thinking. Last year we were talking about the Nautilus Health Institute
yeah.
on this broadcast. Um, what's come of that, and anything that we should be thinking about moving forward
Yeah,
with
yeah.
Nautilus?
Definitely a lot going on there. We were kind of, I look at it a little bit like Nautilus was, if they're building a skyscraper, we were kind of below street level for a while, and laying some important foundations. So there have been these resources we call field guides that are all this guidance on essentially defining what's excellence in procurement, in contracting, and data use. That is this kind of virtuous cycle that we studied and now we educate is if you want to win in this space, you gotta have the right procurement methodology, codify it in contracts, prove it in data, rinse and repeat. But you go and look at that, you're not going to say these guys don't sweat the details, but it's like, whew, it's pretty dense. And so, what's happened in the last year, and give you a little sneak peek, you can go to contractxray.com now. And the first area we've done this is in the PBM contract. We're going to do it with the TPA contract, we're going to do it with the provider contracts, and we're going to do it with the broker advisor contract because, frankly, that's the most important one to get it right. Is work with the right aligned advisor. So you can go there, you have your PBM contract, upload it, and what we have done is, and this is where AI is really helpful, is on the one hand, we've defined as an industry, you go to nautilushealth.org/PBM, and if you know anything about the PBM arena, this is the dream team of the good guys in the PBM arena. Absolute rock stars. They've all poured their knowledge in, and we've collectively synthesized and then defined excellence in these things. So you have excellence like down to the nitty-gritty contract term level. If you have that and you can go download these resources and go, whoa, there's a lot there. Now AI comes along and in it with the right guardrails, with the right training, we can then map every term in that PBM contract to the corresponding term, and then get a score. And so you may not be some PBM contracting guru, but if you upload your contract and I tell you, you know what? Your contract got a 14 out of 100. And if you look at the legacy big PBMs, their contracts vary from 13 or 14 to 34. And so, okay, great. But again, not everybody has time, energy to negotiate that. Contract X-ray, we have this kind of premium report that then gives you the exact negotiating guide. Like, here's the model term, here's why it matters, here's how to negotiate. And if you're DIY, that's great. But again, a lot of people just want the easier button. And so we're now working with PBMs and that we've updated all this to factor in the Consolidated Appropriations Act of 2026, which has all this PBM stuff. And so you can be ready, like in the regulations, that should just be a floor, by the way. And so we've gone to these PBMs, and there's lots of great ones out there, and said, "Hey, you want to score your contract?" Yeah. Oh, geez, I got a 40. Like I thought I was great. Or one of the case studies I didn't mention earlier was a manufacturer in Alabama. They scored their contract. They just negotiated. They thought it did a pretty job, but they did it before the CAA 2026. It got a 28. Like, oof. Like they thought they had a great contract. Well, happily, that PBM's like, yeah, we want to be ahead of the curve. And so there's going to be, by the time Rosetta Fest rolls around, there'll be 5 to 10 great PBMs who will have scores in the excellent range, which is 90 or above. And so you don't have to negotiate every contract term. They will already have this as their template contract term. And that's what is how you have excellence. I'll wave my, iPhone in front again. I don't remember Steve Jobs talking about how much Trios and, Razor phones and BlackBerry sucked. They created something excellent and people went to it. And that's what we're saying. The best PBMs in that example should get the most business. And so that's what Nautilus has been doing is we actually got the first philanthropic support for that a year ago. So it's allowed us to operationalize that. I'm on the board. It's an independent organization. I'm on the board. And one thing I want to clarify that sometimes people will call it quote unquote Health Rosetta's nonprofit arm. That's actually the wrong framing. I mean, there's organizations like Google that are really rich that have a nonprofit arm. We just catalyzed it with about $4 million in intellectual property. Is an independent group. Contract X-ray is a good example where the other things that are in there, we contributed to Nautilus, we open source. We didn't create Contract X-ray. We just, we Health Rosetta are an early adopter of that, but anybody can access it. So there has been a lot going on Nautilus. It's going to be one of the big through lines at Rosetta Fest. There's going to be a lot of Nautilus content, and how advisors and employers can tap into that. Between the Nautilus and then the Rosie Awards, I know there's a bunch of employers that Six Degrees have been a part of that are going to recognize as some of the best employer health plans in the country. That's going to be the major thrust of the event. And so I think people are going to be pretty blown away how much has happened in the last year.
Yeah, it's always an honor to have and be involved with those groups that are getting that recognition. So appreciate the shout out there. We put a lot of work into helping get those plans in that position. So
Yeah.
okay. Anything else you want to kind of hit on? We're down to the final 15 here.
Yeah, yeah. No, I saw somebody put in the chat about whether we'll make the videos available. Um, we do record almost all the sessions. There will be some sessions that will be um, live stream. We have, if you're a college football fan, you know about ESPN Game Day. And so we're gonna have kind of a ESPN Game Day sort of thing. We'll be interviewing people and we're gonna be streaming that live. But as far as the main sessions, we record all of those. We publish some of those freely available, but all Health Rosetta advisors get access to that. And also, if you I think we'll have a virtual ticket, and that's how we've given access to some of the virtual, on kind of a delayed basis, and we share that. So yeah, there is a lot recorded. There is going to be some stuff that will be live streamed. So follow Health Rosetta on um, LinkedIn, and so we'll stream some stuff in there and stay plugged in there. But it takes a while I mean, it's some like 80 some sessions, so it takes us a while to process the video. And obviously, we hope people show up in person, but we know not everybody can do that. So we try to make that stuff as broadly available as we can.
And I've got a session this year, so you know put me on game day. There we go.
Yeah, yeah, heck yeah. We should get you in there.
There you go. Self plug. Hey, one of the things we're seeing a trend with in our book of business is more and more municipalities and cities, educational groups, kind of adopting this unbundled approach to healthcare. Are there things that you guys are seeing that maybe cities, mayors, governors should be thinking about when it comes to healthcare?
Yeah, yeah. No, actually, we have a category of in the Rosie Awards, which recognizes great employers, that is just public sector. So we've had a lot there. Schools, cities, towns, here and there, the states like Montana have done stuff, but mostly it's the schools, towns, cities, counties. And we have a number on the agenda there. One of the case studies that I didn't mention earlier is the Employer Healthcare Cooperative of Wisconsin. Started out with a school district cooperative. Now there's some private sector employers in that and some non-school public employers. And you know, unless you're like in Beverly Hills or something, uh, just about every public entity is really challenged financially right now. And so we're seeing a real ramp up there. And it's funny you mentioned that topic because literally I was working on a paper this morning that is, I've essentially worked on kind of a federal policy framework that I call the Community Self-Determination Act. And, talking to people from, Bernie to Newt Gingrich, and like it's not a partisan thing. Um, but then there's like, who knows if that will ever happen. And so I have a companion that I'm working on that's basically state and local public entity. And like, here's all the things that are already happening you can do today. And one of the things that I really haven't heard too much in our arena, but I think is a huge opportunity for all of us going forward, is this concept called piggybacking. And so the idea is if a public entity has done a very rigorous competitive um, procurement in your state, and a few times there's interstate compacts, then another public entity um, without having to go through all that effort can piggyback off of that, get the same contracts. Obviously, the vendors need to agree to that. But of course, most of them want to grow their business, so they're happy to do that. So that is a really exciting opportunity. And as I mentioned with the Ohio scenario, when the public entities do it, it has a disproportionate ripple effect on the rest. And we know they tend to move slower, but they have a real imperative. I know my own community. I know I'm friends with the husband of the mayor, and so I mean, it's publicly available information, but I hear it. It's like, oh, they have this deficit they're dealing with because of their healthcare spending going up. I'm like, is like, what's going on there? I'm like, oh, well, let me tell you. So yeah, it is a huge opportunity. We see a lot of momentum there. We've had some on my podcast. We had the town of Plainfield recently. As I mentioned, there's a bunch of school districts. In fact, tomorrow I'm doing a webinar with about 30 school districts in Wisconsin. And so there's lots of great activity there.
Very good. All right, I'm gonna toss something out. Curious how you're gonna answer this, but two scenarios. One's a CFO, one's an HR proposing the community-owned health plan concept.
Mhm.
Is it the same pitch, different pitch? What are you saying to each of them to get them on board to hear you out?
Same, well, what resonates with one, is different than the other. I mean, obviously, you have some shared interests, but of course, with the CFO, they're going to, of course, care about the finances. And so when you have stories like in Wisconsin where there's school districts that are spending 45% less per capita while they've improved primary care or they've reduced cost barriers to pharmacy and things like that. And we have um, uh, so that's certainly, public sector, but private sector, you have organizations like Pacific Steel and Recycling, and that's been a case study in previous books. And when I talked to the CFO, what would you have had to do to have the same bottom line impact as how your health plan improved? And this is a 130-year-old company. They're private, but I said, you're probably about 200 million in revenue. He's like, yeah, you're close enough. Um, Pretty tough to increase top line sales revenue 25 to 30%, which is what they would have had to do to have the same bottom line impact. And so that's a really compelling financial story. Of course, they want to make sure care is good and all that. They're humans, but this all assumes care is the same or better. With HR, they, of course, want to help attract and retain talent. And, if you see these companies that rather than taking away health benefits and jacking up um, deductibles every year. They're going the other direction. They're adding dependent coverage. I mean, at the extreme, they're funding college and they're funding home solar and they're funding healthy food and all that. That's a company that is more competitive in the talent war. And they're also, when you have people who don't have all that financial anxiety of, about half of the workforce, their life savings are less than their deductible, and they're kind of the walking wounded coming into work mentally and physically versus having a high performance workforce because they have access into great primary care and centers of excellence. And they are like, we're going to compete on having a high performance workforce. And they become, that HR person, they want to become indispensable to their CEO. They brought this financial thing and they brought a high performance workforce when everybody's, tighten their belts. It's a great story. And, one of the earliest stories that was in my first book was Innovation Controls, a manufacturing company in Oklahoma. And Justin Bray was the HR leader. He's the CEO now. Like, I'm not saying every HR person wants to become a CEO, but man, that shows you how compelling they are to their leadership. And so those are the ways that I would frame it with a CFO or HR leader.
Okay. All right. So we talk a lot about the impact on advisors and the role that they play. Um, and one of the things that we as an organization, and I would assume you guys see as well, is the TPA component to the whole ecosystem.
Yeah.
And sometimes that can be a very positive experience, and sometimes it can be the opposite. If you were to take a component of your book and point it in the direction of an executive at a TPA, what would that be, and what do you think the lesson you're hoping to learn there would be?
Yeah. TPAs have a tough job, so I don't want to um, sort of diminish how tough a job they have. Um, and variability is what makes their job tougher. And so, one of the things going back to the Nautilus scenario, and one of the things we've just done with community health plans as an example, is if you're a TPA, do you really want to have 50 different versions of your contracts? Um, you want to have a standard one that's high performance and predictable. And so, just like what we're working on with the PBM, if you work with us, we don't have the contract X-ray live yet, but work with us to develop what are these new industry standards? And um, independent TPAs in particular are a small percentage of the overall market, maybe 10, 20% of the market. The way you grow that, going back to my detour away from healthcare, one of the things I was involved in was setting industry standards for the digital advertising industry. And because at one time, if you were Nike or Procter and Gamble and you want to do a big ad buy, it was a complete mess digitally. You'd have to recreate your ad literally hundreds of times to fit all these different sites. And so we did things, that was one example on ad size standards that was kind of more data level stuff and all that. Digital went from like 2% of the ad market to now it's surpassed every other category. And that was one of the big reasons. And so there are times where it makes sense to work with your competitors, like what's happened in the PBM arena, because your real competitor isn't the other independent TPA, it's the big guys, and moving the industry forward. And so that's one of the things that we have started to do just within Health Rosetta, kind of standardize these contracts and have reasonable expectations. And we can be helpful too in pushing back against Because in fairness to them, sometimes some broker advisors ask them to do things that are going to be operationally really problematic. And we can help educate that community like, hey, yeah, I could see how that could work for this one company in a perfect isolated world, but they're not the only employer in the world. And so we need to put our heads together to standardize these things. And you've seen this in financial services where the cost to transact certain financial transactions has gone down 97.5%. That's kind of what we're trying to do here. There's just a lot of administrative gunk and slowness in the system. And that's part of, I think, what we bring to the table is we didn't claim to have invented this stuff. What we've done is figured out how do you replicate this stuff much easier, much faster. We've been a part of things that have gone from, I signed the first Microsoft partner agreement in healthcare to there's 28,000 partners in Microsoft's healthcare ecosystem. And so we need to take this thousands of companies and turn it into tens of thousands and hundreds of thousands. And um, standards is one of the three key pillars of moving an industry and agreeing on that. So that would be where I would focus my conversation with them.
All right. 30 seconds. If the book lands the way that you hope, what's success look like 5 years from now?
A bunch of communities have been activated, led by aligned advisors and aligned clinical leaders, because they're a really key part of this. And they are grinding through what I've laid out in the book as kind of we have a 6-stage process for community-owned health plans. And so in 5 years, they should be easily in step 4, 5, and 6. And we're very pragmatic, like how you can take a step at a time. And a lot of the things, in this 5-step plan at a company specific level for the 5 steps are either invisible to the member or clearly a positive. Um, the final step, and this is where an organization like 6 Degrees is so important, is that is the highest bang for the buck, but also the one that is, you got to do it right. You got to work with the right partners. You got to have the right change management, but you can make huge progress along the way as you build towards that. And so that would be what I would see is company or communities are well down that path. And then the individual, like every company is a community, right? They are a little community, and those different nodes in the network are getting meshed together. And so that's what we see happening over the next 5 to 10 years.
Excellent. Dave, thank you so much.
Yeah.
Appreciate you being here. We have reached the top of the hour, and my phone keeps ringing because I've got
All right.
kids to go
Well,
pick
hopefully
up. So,
kiddos are okay, and
oh,
I'll
they'll be
let you
fine.
go.
At least I hope they're good. But yeah, thank you so much. Also, if you guys are around middle of August, come join us. August 12th, we'll have Lester Morales talking about disrupt benefits. So, thank you guys. Appreciate it very much. Take care, everyone.